What's going on, guys? My name is Steven. I'm a licensed physical therapist, and in this video we're going to discuss stretches that you can do if you're suffering from low back sciatic nerve pain. Now, what is sciatic nerve pain? Typically, it occurs in younger to middle-aged people, usually from poor posture, poor lifting techniques, or muscle imbalances. So what actually happens with sciatic nerve pain? Typically, one of the discs in your low back is protruding or bulging out of the space that it normally occupies. Specifically, it's the inner part of the disc, or the nucleus of the disc, that gets pressed backwards towards your spine and towards your spinal cord. Now, the sciatic nerve is a branch that comes off of the spinal cord. It's a very large nerve that branches off into several other nerves. Many times, the sciatic nerve can be pinched in the low part of the back or even in the glute region. And this will typically cause pain either in the low back, glutes, or even down your leg into your foot at times. The pain is usually described as sharp, shooting pain that comes on all of a sudden, and when you change positions, it may go away all of a sudden. I'm going to include a photo up here that shows what happens when the disc bulges out and intrudes on the sciatic nerve. You'll see it's the red part of the disc. Now, something else that I want to mention in this particular video, I'm going to show you stretches that normally work for a lot of my clients that come in with sciatic nerve pain. But if any of these stretches bother you or increase symptoms, then I'd want you to stop. So with that said, let's go ahead and get started. So for the first stretch, all you're gonna have to do is sit down on a couch, a bed, anything like that. Now, the first thing you actually wanna do is slump down. Now, normally this is not good posture, but for this particular stretch, you do want to stretch the nerve, and that includes stretching out the back in this way. So you want to slump down, okay, bring your back down. So you wanna round your back out. And now what you want to do is, if you have sciatic nerve pain down on one side, then just work on that side. If it's on both, then just do one leg at a time. So what you want to do here, so say it's on my right side, what I'm going to do is kick that knee straight out, nice and slow. If you can get up all the way, that's great. If not, if it starts to hurt or you feel a stretch, just stop at the point where you start to feel that. Okay, maintaining this back position. Now, from this position, what you want to do is you want to gently tilt your head back and then bring your head straight down. So again, going nice and slow, making sure this doesn't increase symptoms. If you do feel a stretch, that's perfectly fine. So you want to gently tilt your head back and then bring your chin straight down while keeping the position of your knee. Now, I would say do about 10 repetitions. If that feels pretty good, then we'll move on to the next part of this exercise. For the next part, you want to maintain the same position as you were in for the first part, but now you want to add the foot movement as well. So as you move your head back, you want to gently bring your toes up towards you. And then when you bring your head down, you want to bring your toes down towards the floor. So you're doing this nerve glide of your sciatic nerve. So you're bringing your foot down and your head back. So you're in sync with your foot and with your neck. So again, do about 10 repetitions. If this feels pretty good, then let's move on to the last part of this exercise. So now what you want to do is you want to maintain that same position. So slump down, bring your foot straight up, and now you want to go out of sync from your neck with your foot. So what I mean by that is when you bring your neck down, you want to bring your foot up towards you. So that's going to place the most amount of stretch on that nerve and on your hamstrings as you can. Okay, and then you want to gently come out of that and then come straight back. So as you're bringing your neck down, you're bringing your foot up towards your head. You should feel a stretch. Just hold for a brief second or two and then come out of it. So you want to gently glide that nerve from your neck all the way down to your foot. So do about 10 repetitions. As long as it feels pretty good, then you can continue with this exercise every single day. So for the next progression, you're going to need to come down on the floor, or you can perform this in your bed. The first part of this exercise is very simple. All it is laying down on your stomach. For some people, this may actually trigger their symptoms. So if it does, then you're going to want to just put a pillow underneath your lower abdomen region just to get a little bit less of that extension. The thing about a bulging disc, typically in young, healthy adults, is if you place your low back into extension, you're gently pushing that nucleus part of the disc back into place. So this is a very important exercise if you're young and healthy and had an injury because of a lifting mistake. So again, the first thing you want to do is just lay down on your stomach, This may be enough for some people. If this feels pretty good, then the next thing you want to do is prop up onto your elbows. Okay, so all you're doing is getting that extension through the low back right here. So you want to maintain this for a few minutes if it feels comfortable. Now the last progression of this exercise is going to be press ups. So it's basically like a push-up, but you're only extending through your low back and you're not bringing your whole body up. So what I mean by that is you're going to come up onto your hands, you're going to leave your hips down on the floor, and you're just going to press straight up. So you can see how much extension I have now in my low back, and then gently come back down. So this you want to go nice and slow with. Make sure that this does not provoke symptoms. If it does, then stop. But if it feels pretty good, then I want you to continue doing a set of 10 press-ups, just like this. So make sure you keep your hips down on the floor, and you're just extending through that low back, pressing up, holding for a couple of seconds, and then gently coming back down. Another exercise that is great for your entire spine is called the cat and the camel. So for this exercise, you're going to need to get down onto your floor or your bed. You're going to put your hands down about shoulder width apart. You're going to be on your knees here, and all you're going to do is arch down. Again, go nice and slow, and then I want you to arch your back straight up like this. So make sure you're going nice and slow. You get a stretch at the bottom here, and then you arch up, and you get a stretch right in here. Okay, so again, you're just shifting your pelvis back and forth, anterior and posteriorly. Make sure that this does not increase symptoms. If it does, go a little bit easier. If that bothers you, then just stop the exercise completely. I would perform anywhere from 15 to 20 repetitions of this exercise as long as it feels good and it doesn't increase symptoms. Make sure you're doing it every single day. The last exercise that we're going to do is standing back extensions. What this is going to do is something very similar to what we did on the floor earlier, is just work on that back getting into extension and pushing that nucleus part of the disc back into its proper position. So what you want to do is bring your hands kind of on the side of your glute region there, okay, just to stabilize it. And you want to gently tilt back and then come back to the middle. So all you're doing is basically pushing your hips forward, extending your low back, and then coming back to neutral. Make sure your core is nice and tight. You don't want to just be flopping around. So keep your hands at your side. You want to tilt back as far as you feel comfortable, and then come back to the middle. All right, so you're going to do about 20 repetitions of this exercise as long as it feels okay. Again, if it starts to bother you, if you feel that shooting pain down your leg as you're doing this, then I want you to stop. But if it feels really good and your symptoms are actually improving with these exercises, then make sure you're doing them every single day, 3 to 4 times a day. So as you guys can see, there are certain exercises and stretches you can do at home for sciatic nerve pain that aren't just laying around and waiting for it to heal. If you do these exercises properly and they feel pretty good, then make sure you continue with them every single day. Just be sure to monitor your symptoms, that they're getting better and not worse. I'm going to make a future video also related to low back and sciatic nerve pain that focuses more on strengthening exercises for your low back and for your core that'll help the same people as this video will help. So if you're suffering from low back and sciatic nerve pain, just remember there is something you guys can do about it. If you found value in this video, please give it a like, make sure you subscribe to the channel, and hit that notification bell so you can see anytime I upload a video. My plan is to upload a video every single day during the week, Monday through Friday, and when I can on the weekends. This channel is going to be geared towards fitness and health, but since I'm also a physical therapist, my passions lie in therapeutic exercises and treating specific conditions, such as the ones in this video. I really appreciate you all for watching the video. Look out for more great videos coming soon. Thanks a lot, guys. Bye-bye.